New York City now has a new ally in the fight for crucial supplies in the battle against coronavirus. Former NYPD Commissioner James O'Neill has now been named a senior advisor. He will oversee the supply and distribution of equipment at hospitals. Now, as far as that supplies goes, Mayor de Blasio says that hospitals still need millions of N95 and surgical masks. 100,000 isolation gowns by Sunday to be able to handle the influx of patients they're expecting. Now, in New York City, all playgrounds are closed, expected to be locked up by the end of the day tomorrow. That order came from Governor Cuomo to improve social distancing. Sadly, though, tonight we have learned a 7-week-old girl is now among the dead in Hartford, Connecticut, believed to be the youngest life lost during this pandemic. As of today, Connecticut has more than 3,500 cases and 85 deaths. In New Jersey, more than 22,000 cases, 355 deaths there. New York, 1,941 deaths. The state has almost 84,000 confirmed cases. We want to go now to News 4's Andrew Siff live in Long Island City with the latest on New York's changing situation here, Andrew.
Right, and here in the city we have new numbers, 1,374 fatalities in New York City. The mayor has repeatedly said that is going to get worse in the coming days and weeks, and as a result, today he tapped his former police commissioner to try and supervise all those people on the front lines, the doctors and the nurses, and coordinate it all and make sure everyone has the gear that they need. Workers on the front lines, like these first responders today in Astoria, facing their biggest challenge in the coming weeks with a predicted peak in the coronavirus crisis. And today the mayor naming his former police commissioner as a COVID-19 czar, in charge of making sure everyone has what they need.
So I've asked Jimmy O'Neill to develop a system for ensuring that we'll have personnel in every hospital where they're needed.
Make sure that we're sourcing, delivering, distributing, and tracking to make sure that we do our best, continue to do our best for the healthcare workers that are out there right now, this very minute, doing their best to save lives.
The city also moved today to close all playgrounds after getting ordered to do so by the governor. The mayor had initially said only 10 playgrounds needed to shut down, but Cuomo said too many New Yorkers got too close to each other.
I warned people that if they didn't stop the density and the games in the playgrounds, you can't play basketball. You can't come in contact.
Here in Long Island City, some enjoying the playground now, understanding why it'll be shut down.
We did a little baby steps, and we wanted to make sure that, everybody was safe, and then maybe people came around and saw that they weren't keeping the distance, and then they had to do it.
And today in Central Park, a field hospital received the first patient, a non-coronavirus case aimed at easing the pressure on the nearby Mount Sinai ER. Lenox Hill Hospital, the latest to add a refrigerated area that could be used as a morgue. At NYU Langone, the head of the emergency department said one silver lining is New Yorkers have gotten the message to avoid ERs unless they're truly ill.
The overall patient volume is down. For example, our Manhattan ER, the volume's down about 1/3.
Now, on the issue of the playgrounds, you can see the swings are empty now. All of the playgrounds are going to be empty by the end of tomorrow because city workers are going to lock them and chain them shut. But some transportation groups are pressing the mayor to open some more streets to pedestrians because as the weather gets better, people are going to be looking for a safe place to go outside and keep that social distance. We're live in Long Island City, Queens. Andrew Siff, News 4 New York.
All right, Andrew, thank you very much. COVID-19 has breached the defenses of yet another nursing home in New Jersey, claiming 5 lives. And that nursing home in New Milford has 22 additional confirmed cases, 16 residents and 6 staff members. News 4's Brian Thompson is live in New Milford with the dreadful waiting game the patients' relatives are now forced to deal with. Brian?
Yeah, Chuck, this is getting real old real fast. The state health commissioner saying she now believes the surge in North Jersey has begun, and that is certainly evident at this nursing home here where they're reporting 5 of those 16 patients or residents have indeed died from the coronavirus. Now, this totals, what the commissioner was saying is that 25% of all nursing homes in New Jersey, there's 375 of them, 25% have at least one case of coronavirus. At this Care One nursing home in New Milford, where at least 5 have died after testing positive for novel coronavirus, ambulances still busy with those most ill. A total of 16 residents and 6 staff testing positive so far, including the 5 dead. And Edna Maldonado, who celebrated her mom's 88th birthday last summer, not being told her status now.
But now that I'm hearing all of this, I'm a little worried. I want to know what's really going on.
What happened here is not a first. Now one of at least 3 long-term care homes in New Jersey reporting 3 or more residential deaths. Monday, it was Lakeland and Wanacue. As many as 8 dead there, including a staffer. Last week at St. Joe's in Woodbridge, 3 residents reported dead. The staff so depleted by illness that all surviving residents were evacuated to a Care One home a half-hour away, and converted specifically for just COVID-19 patients. As for Edna's grandmother, Iris Salart, someone she visits frequently, but now not being told if she's sick or not. The last time Edna saw her was nearly 2 weeks ago.
She did cry because not seeing me for several days and knowing, you know.
How often do you normally see her?
Well, before this, I come either every day or every other day when I can.
Then there was this tweet from Governor Murphy this afternoon about a Teaneck resident who died, 60-year-old Janice Purcell, the founder of a food pantry called Helping Hands.
And I quote Teaneck's extraordinary mayor and the township of Teaneck, as they put it, quote, "They lost a true woman of valor."
Now, with more than 22,000 people ill with or diagnosed positive with the coronavirus and more than 300 people dead, New Jersey is not that far behind New York. And at this point now, the governor and the health commissioner reporting 7 hospitals have had to divert patients because they're full, too full, with novel coronavirus cases. Live in New Milford, Brian Thompson, News 4 New York.
All right, Brian, thank you. And very sad to report tonight, just a heartbreaking story out of Connecticut. The latest victim of the coronavirus includes a 7-week-old girl from Hartford. Officials say she was rushed to a hospital last week, unresponsive, and never recovered. Overall, there are now more than 3,500 confirmed cases of COVID-19 in Connecticut, including nearly 2,000 in Fairfield County. 85 people have died, including 46 in Fairfield County.
I just did another one of the executive orders. This one we just reminded people at grocery stores that we're not going to allow more than 50% of capacity. So if your grocery store has maybe capacity stipulated for 100 or 150, you can't have more than 50 or 75 in there.
This afternoon, Governor Lamont visited the campus of Southern Connecticut State University in New Haven. That's where the National Guard is setting up a mobile hospital you see there. It will have 250 beds, Chuck.
Well, Natalie, now to the pandemic's impact on our first responders, you know it's having a significant impact on them. More than 6,000 police officers are out today, sick. But there is one positive update. Crime is way down, with a few startling exceptions. News 4's chief investigative reporter Jonathan Dietz is live in the newsroom right now with that part of the story for us. Jonathan.
Yeah, one of the exceptions taking place this morning, a man with a gun allegedly claiming he wanted to die because he was just diagnosed with the coronavirus. Police say it's all on body cam, the man running right at police in what appears to be a suicide by cop attempt. The 911 calls came in around 4 this morning, Westchester Avenue, a man with a gun and bloody knife. When officers arrived, the man allegedly ran right at them, refusing to drop the weapons. Police fired about 10 times, injuring the man. From the hospital, he allegedly said he hoped cops would shoot him because he just learned he had coronavirus.
He had just been diagnosed with COVID last night. He's overweight, has diabetes. He thought that he was going to die, so he wanted the cops to shoot and kill him. So this was apparently an attempted suicide by police officer. This unusual case coming at a time when crime is down, with many people staying at home. Overall crime this past week down 36% across the city. But burglaries are up. Police now boosting patrols in some shopping districts. We have to make sure that we're out there watching these businesses, preventing people from taking advantage of the closed stores. This is the NYPD is working with 17% of its workforce out sick. 6,100 officers called in sick. 1,400 officers and civilian staff have tested positive.
and 5 have died, 4 civilians and 1 detective. But 167 did return to work today, 45 who had tested positive for the virus.
So there is a light at the end of the tunnel. As more and more officers do get sick, a lot of them are getting well and getting back out on the streets.
With the increasing number of sick calls, the NYPD is moving some plainclothes narcotics officers and desk officers into patrol units to make up the shortfall. Officers also being placed outside hospitals with lines of patients seeking help. They're trying to keep everyone safe and at a safe distance from one another. In the newsroom, Jonathan Dienst, News 4.